Welcome to Medicine and Health Info MK. We are dedicated to bringing you health information that is clear, useful, and sometimes quite surprising. Today, we're going to explore a topic that is incredibly important but often overlooked. We are talking about your liver. This amazing organ works tirelessly inside you, cleaning your blood, helping you digest food. It is one of the hardest working parts of your body. But what happens when it starts to have trouble? Many people think liver problems only show up in serious ways, like yellow skin. However, your body often sends subtle signals much earlier that can appear on your hands, that can appear on your feet. Have you ever really looked at your hands? Truly studied them? They can tell a story about your health. The color of your palms, the shape of your nails, tiny marks on your skin. These are not just random changes. They can be your body's way of whispering that something is not right. Your liver is a silent powerhouse, performing over 500 vital functions without you even noticing. We are going to uncover 5 specific signs. The first sign we will discuss is called a spider angioma. Imagine a tiny red dot on your skin, with little red lines branching out, just like the legs of a spider. These spots are usually very small, less than the size of a pinhead, but their spidery extensions make them noticeable. They most commonly appear on the hands, face, neck, upper chest. When you press on the central red spot, the entire mark will temporarily fade or turn white. Then the color rushes back as soon as you release the pressure. It's a very distinct feature that sets it apart from a simple red mole or freckle. So why do these spidery marks appear? The answer lies in your hormones, specifically estrogen. Your liver is responsible for metabolizing hormones and keeping them in balance. When the liver is damaged, it cannot process estrogen effectively. That leads to higher levels of estrogen circulating in your blood. This excess estrogen causes tiny blood vessels near the surface of your skin to dilate and swell, creating the central red dot. The branching lines are the small capillaries affected by this change. Here's a curious fact. Their location can be a clue. They're most strongly associated with liver disease when found on the upper half of the body. Recognizing this unique web-like pattern could be the first step in identifying a liver issue early. Paying attention to these small details can make a world of difference. Now let's turn our attention to the palms of your hands. The next sign is called palmar erythema, which is a fancy medical term for red palms. Quick visual: side by side normal palm versus red palm. This is not the kind of redness from heat or cold. This is persistent, often blotchy redness affecting the fleshy parts of the palm, specifically the area at the base of your thumb, and the area along the side of your hand below your little finger. The center of the palm usually stays its normal color, making a distinct pattern. The redness might feel warm, but it usually does not itch or hurt. Like spider angiomas, palmar erythema is often linked to hormonal changes from a struggling liver. Elevated estrogen levels play a major role. Excess estrogen causes small blood vessels in the palms to widen. They dilate. That increased blood flow near the skin's surface makes the palms look red. It's another way a liver problem can show up externally. Your hands become a billboard for internal health. Fun fact: palmar erythema is sometimes called liver palms, but it's not exclusive to liver disease. It can be normal in pregnancy because estrogen surges. However, when it appears in men or non-pregnant women, especially with other signs like spider angiomas, it becomes a stronger indicator of potential liver trouble. That knowledge helps you connect the dots and seek medical advice sooner. Let's move from the color of your palms to the shape of your fingers. The third sign we will explore is known as finger clubbing. This is a very specific and unusual change in the appearance of your fingernails and the tips of your fingers. To check for it, look at your fingers from the side. In a healthy finger, the nail comes out of the finger at a slight upward angle. With clubbing, the nail starts to curve downwards, like an upside-down spoon. The fingertips themselves may also become wider and rounder, appearing swollen or bulbous. It is a gradual change that you might not notice at first. Here is a fascinating way to check for early signs of clubbing, known as the Shamroth window test. Place the nails of your 2 index fingers together, back to back. On healthy fingers, you should see a small diamond-shaped gap between the nail beds and the top of the fingers. If your fingers are starting to club, that gap will disappear. The exact reason why liver disease causes finger clubbing is still a topic of scientific investigation, but a leading theory involves platelets and a growth factor called PDGF. The liver produces a protein that helps regulate platelet production in the bone marrow. When the liver is damaged, this regulation can be disrupted. Tiny clumps of platelets may get stuck in the small blood vessels of the fingertips. Those platelets release platelet-derived growth factor, or PDGF, which causes soft tissue in the fingertips to grow, leading to the swollen, curved appearance of clubbing. Our final set of clues is found right on your fingernails. The nails can be like a small canvas, painting a picture of your overall health. Two specific nail changes related to liver disease are Terry's nails and Muirkey's lines. With Terry's nails, most of the nail appears a milky white or ground glass color, with only a narrow pink or reddish-brown band at the very tip. It can affect all of your nails and gives them a very distinct two-toned look. It is as if most of the healthy pink nail bed has been erased and replaced with an opaque white color, leaving just a sliver of normal color at the end. The reason behind Terry's nails is thought to be a decrease in blood supply to the nail bed and an overgrowth of connective tissue. Your liver is responsible for making many important proteins, including albumin. In advanced liver disease, the liver cannot produce enough albumin. Low albumin levels can cause fluid to shift in the body and lead to changes in the tiny blood vessels under your nails. This combination creates the characteristic white appearance, masking the healthy pink tissue underneath. On the other hand, Muirkey's lines are different. They appear as paired white lines that run horizontally across the nail. Unlike other nail lines that grow out with the nail, Muirkey's lines stay in the same place on the nail bed. If you press on the nail, the lines will temporarily disappear. This is a key feature that distinguishes them from other marks. These lines are strongly linked to low levels of the protein albumin. When your liver is not making enough albumin, these parallel white bands can form on the nail bed. Muirkey's lines are almost exclusively linked to severe hypoalbuminemia, or low albumin. This makes them a very specific indicator of a problem with protein synthesis, pointing toward organs like the liver or kidneys. Remember to look at the health of your body as a whole, as we have seen today. Red palms, curved fingers, white nails. Your hands and feet can offer invaluable clues about your liver. If you notice any of these strange and persistent changes, please do not ignore them. It is always best to consult a doctor to get a proper diagnosis and care.